It's time now for perspective. 4 months on from Hamas's attacks and Israel's counteroffensive in Gaza, the humanitarian situation in the enclave is dire as the death toll continues to climb and the injured struggle to find adequate treatment in hospitals that are on the brink of collapse. And while aid trucks are now regularly entering the enclave, aid agencies are warning they don't come close to covering the diverse needs of desperate Gazans. My guest today is Ricardo Pires, a spokesperson for UNICEF, that is the UN's Children's Fund. Thank you very much for taking the time to speak to us on France 24 today. Now, a few days ago, UNICEF said that most young children and pregnant women in Gaza are not getting enough food to eat. Just how acute is the lack of food in Gaza right now?
Thanks for having me. Very acute. It's a very important question, and even though I'm not a nutrition specialist, I can confidently say that children and families in the Gaza Strip today are at high risk of famine if this situation persists. This is something that moves very quickly, deteriorates very rapidly, and you're right, the situation is very dire, and we shouldn't have to wait for such a drastic reality to happen before we act. Young children especially are at very high risk right now. We can't exactly predict the time frame when children get severely malnourished, but we know from 2 to 3 weeks, it can be enough for an infant or a young child who lack food to become severely ill and cross that deadly line into severe acute malnutrition, which is the most deadly form of malnutrition. So they are at very grave risk right now. About 90% of children under 2 years of age are consuming two or fewer food groups. So that's very little for such a young child to survive every day. According to a UNICEF survey conducted later last year, this is up from 80% of children compared to the same survey conducted 2 weeks earlier. 335,000 children under 5 years of age are at greater risk of severe malnutrition. So as you can see, it's a very concerning situation. I would say it's a high alert for UNICEF and aid agencies to support these children, because if it continues to be like this, with bombs falling from the sky and disease spreading on the ground, they are going to die very rapidly.
And you talk about disease spreading rapidly within the enclave. Swathes of the enclave have been reduced to rubble over the course of the last 3 months. Gazans, over 2 million people, are living in a smaller and smaller area. What sort of health impact does living in those ever more cramped situations mean for people living in Gaza right now? Well,
it just pushes them to an even sharper edge of this crisis under the current besieged conditions they're living on adequate supplies for areas where so many desperate people are fleeing for their lives every day are impossible. UNICEF has colleagues on the ground. We speak to them every day, and they're seeing this catastrophe. So there is no fully operational water system in Gaza now to provide safe water to hundreds of thousands of people in desperate need. So their sanitation condition and the water they are drinking, contaminated water, is catastrophic, and that will lead to disease. That will lead to an increase, for example, in cases of diarrhea. It will lead to diarrhea outbreaks, which we are seeing on the ground already. Just as an example, at the current onset or setup, children are having to share one toilet. Every 700 children and families are sharing one toilet. So the conditions created by that are just absolutely rampant for disease to spread, for children to get severely ill, as I said, with diarrhea being the first concern right now, but it will possibly spread into other health conditions. So it's just rubble. They're living on the rubble, and the shelters they have right now are not adequate. They're not safe, and safety is not only from bombs, it's safety as well from disease. The conditions for water, sanitation, and food need to be in place for them to be called safe places. And there is no safe place for a child in Gaza right now.
You say that the shelters in Gaza aren't safe. What about the state of Gaza's hospitals right now? Are hospitals, or indeed the hospitals that are still functioning, are they equipped to treat the patients that come to them in need?
Absolutely not. They are working at 200, 250% right now in terms of their capacity. The number of injured people and children arriving is overwhelming. They have no means to respond to that horrendous influx of children affected, impacted, wounded, sometimes killed by war. And this has been happening for 90 days when some of these hospitals themselves, as we saw in Khan Yunis and before in the north, became war zones. So it's impossible for health workers to respond to the needs of patients right now, and without adequate supplies or fuel to run incubators, for example, babies are at risk. Premature babies could die. We managed to relocate some earlier in this crisis, but as the situation escalates and we see no improvement on the ground, it's very likely that these conditions will worsen and hospitals at some point will simply collapse.
Now, you said just then that hospitals have been the site of intense fighting. In the beginning of this war, hospitals were by large numbers considered safe places to shelter, to seek safety. Is that still the case in any respect? Do people still seek out hospitals in the hope they may be safe there?
They might seek the hospitals, but I can say it again very confidently, there is no safe place for children in Gaza right now. They've been moved around from north to south and then moved again. And this is a very one of the most densely populated places on the planet. So there is not a lot of room for maneuvering when bombs are falling from the sky, and the conditions on the ground are worsening with a lot of rubble and destroyed infrastructure. So no, the hospitals are not really safe places for children or civilians right now in the Gaza Strip. But since they will be injured, or they continue to be injured by these attacks, they will try and seek medical supply or health support in these hospitals. But I've heard stories from colleagues on the ground when children and families get injured and parents decide not to take their children to the hospitals because they know that journey itself can be very dangerous, and what they will find in the hospital is not the support they would expect given the very dire circumstances.
They've already talked about some children in Gaza being on the brink of starvation. About 200 aid trucks are now entering Gaza every day after being all but halted at the start of this conflict. I have a feeling I know what you're going to say, but to what extent is the content of these aid trucks sufficient for the needs of the children of Gaza right now?
It's not sufficient. It has never been sufficient. Since the onset of this crisis, we've been saying that unless there is a humanitarian ceasefire whereby humanitarian workers' aid and supplies can cross through from different corridors and get to the people in need, we will continue to see, people dying, children dying, the catastrophe escalating. And it's not only about the number of trucks that cross into the Gaza Strip. We might have more trucks coming in with even more supplies, but the operations on the ground are not allowing for humanitarian workers and aid to be distributed accordingly. And I can give you a few examples of why that's happening. There are many layers of inspections before trucks can even enter the Gaza Strip. There's confusion and long queues, a lot of chaos, a growing list of rejected items, crossing points that are meant for pedestrians, not trucks, so trucks can really continue their journey in the way that you would expect them to. They're big vehicles, so they need space, they need the conditions to be able to move. And then, when they manage to, there's another crossing point or a blockage found by, desperate, hungry communities, constant violence and bombardment. So I can go on, but this is more or less the conditions in which aid is being delivered, which is far from ideal unless there is a humanitarian ceasefire and we start working on opening these paths and making sure the logistics on the ground work. Only trucks and supplies coming in won't be enough.
Ricardo Pires, UNICEF spokesperson based in Florence, thank you very much for speaking to us here on France 24 today. I'm afraid that's all we have time for.
Thank you.